I was Carly's primary care pediatrician from day one, so I actually saw Carly in the newborn nursery and realized on day one actually that she didn't quite look like all of our newborns normally do. I actually called the Progeria Research Foundation, asked them permission to do a test for progeria after we'd done some other tests and had not come up with a definitive diagnosis. So at about 9 months they allowed us to do that test after we had discussed it with a geneticist, and then at that point we got the diagnosis just after 9 months.
The geneticist said, I think she has progeria, and I didn't know what that was. And I said, what does that mean? And he said, it's the aging disease. And just like that, I mean, by her facial features, because she has dysmorphic features, and so we did the test from that. So I would say initially, and 2 weeks later they confirmed it.
Exceedingly rare. We know of about 100 cases worldwide. We think there's probably another 150 out there to be diagnosed. So anytime in the world we think there's somewhere around 250 cases. The key in progeria is trying to prevent production of this abnormal protein or prevent attachment of that abnormal protein to the cells, and that's kind of where the research is kind of focused right now. Kids with progeria are faced with this rapid aging process, and so they're normal in terms of their intelligence. They're wonderfully happy, normal kids, but they suffer the effects of rapid aging on every system in their body.
She's going to be 3 years old here in June 19th, and she's very happy, fun, energetic, even though her condition of progeria stunts her growth and lack of hair, which we're trying to grow, but she's mentally, just like any other 3-year-old.
Well, when you look at a patient with progeria, they're a very specialized patient and they require very specialized care. So multi-systems are involved. When it comes to cardiac is probably the most common cause of death in this patient population. However, these patients probably by the end of their first decade of life have to be investigated for signs of chest pain, similar to our grandparents or the elderly population.
In progeria, we are having atherosclerosis of the arteries. And again, that can affect the arteries of the heart, affect the arteries that go to the brain. And when you're having that narrowing in the arteries due to the deposition of the cholesterol and the arteries are becoming weak, so there's decreased blood flow, you're going to have effects that are due to a decreased blood flow to those areas of the brain.
Probably the primary finding you see with progeria initially is poor growth, both weight gain and linear growth. So after the first year or so, they start growing very poorly, not gaining weight. And that can be a problem for the overall development as well. So one of the things that we've done is we've started her on growth hormone, which is used in children that can't make growth hormone, but it's also known as a mitogen or a stimulator of growth of cells. And it's working in Carly as far as helping her to gain weight, making sure that someone's watching her nutritional status and making sure she's getting enough to eat. She's staying active, that doesn't sound like that's a problem, and getting enough sleep, because all those things are going to be important for her health as well as her overall growth.
It's a team effect, honestly. Yeah, they put together just all-stars, doctors that are renowned in their fields and amazing and well-respected, that talk to each other, which is enormous, and talk to us in words that I can understand.
Okay.
And for Carly, what's most important is that there isn't a protocol for her. So they're talking with researchers around the world for us. And I don't know what I would do without that, right? Because I don't know if anyone else would do that.
What sets us apart is we not only have the expertise and the knowledge, but we have that kind of warm, loving, compassionate care, and that's delivered primarily not by just the doctors, but by the nursing staff. The nursing staff here is unbelievably compassionate. The families love the people they work with, and when they do leave the system, they can't wait to get back.
You never know. It's like giving blood. You don't know when you're going to need it, and you don't know when your niece is going to need it or when your daughter's going to need it. And it makes all the difference in the world to have these brains behind us and on our team, and caring about Carly. All the difference in the world for, you know, these 5 guys and their team of nurses and nurse practitioners and everybody putting all the data together in one place and looking at it holistically. Nobody does that. They do it here.
The knowledge that these guys bring, their experience, their wisdom, and also their wonderful personalities and relationships, not only with the primary care doctor, but the family.
You know, at first we didn't know what to think, and we didn't know how to tell the kids, and we didn't know how to tell our family, because we didn't want to say anything that would be, we didn't want to convey it to them being upset and have them be upset back. So we had to kind of wait until we were able to talk about it. And once we decided we wanted everyone to know, because it's so rare, that we thought it would only help, you know, with progeria awareness, and also that way people wouldn't stare at Carly, and they would be more supportive, and the community is amazing. It's crazy that progeria might be a blessing, right? Because I think she's going to change the world, but also that we know in advance. You know, we knew at 10 months what was going on with Carly, so we have the chance to. I feel worse for people who have a 5-year-old or a 10-year-old or a 15-year-old who passes away unexpectedly, and they didn't know, and maybe they just were on autopilot and worried about the wrong things and just trying to do, you know, your day-to-day activities. Or we know. So we say we live like crazy. We're gonna live like crazy. And hopefully we'll be living like crazy until she's like 60 or 80, which will be a lot of crazy.